Okay, so we're gonna hear from Dr. Lee Biddison. Dr. Biddison is our Chief Wellness Officer, and she's going to tell you about resources through the Office of Wellbeing.
Good morning, everybody. So as Rachel said, I'm Lee Biddison. I've been here since 2004 when I came for fellowship in pulmonary critical care medicine and joined the faculty in that division of the Department of Medicine in 2008. I have a deep love for this place, and I hope that you will too. I'm going to spend a little bit of time telling you about the Office of Wellbeing. I have about 10 minutes, so I will talk fast. The first thing to mention to you is actually that we have a little bit of a unique approach to well-being. Sorry about that. To well-being. I don't do well standing behind podium. Sorry about that. A little bit of a unique approach here at Johns Hopkins. There are about only a handful of places who use an integrated approach across role types to think about well-being. But it is our firm belief that we deliver care, we do science, we do education in teams. And so we have a team in our office that includes myself, Carolyn Cumsty-Fowler, who is our executive director for nursing well-being, and Rich Saphir, who is our our medical director for employee health and wellness and runs our Healthy at Hopkins program. And we're working pretty hard to be sure that we deliver integrated services. I may be one of the few people who's actually going to ask you to not pay attention to me for a minute and use the QR code. So the QR code that is here on the screen takes you to our website, and everything that I will highlight is there on the website. So I would love to just be sure that it's working. I checked it myself, but also want to be sure that it's working for you. So briefly, what is well-being? There is, in our view, historically, we've had a pretty narrow view of well-being. Folks think yoga and kale and maybe a meditation app. And if you don't have the Calm app, I highly recommend it. It is a free resource to university employees. And I'm happy to, there's some instructions on our website. I'm happy to tell you to get it. Use it. Having said that, it is, in my view, and in our view as a team, necessary or helpful, but not sufficient. This graphic is actually from the Surgeon General's office, and it was published just about 18 months ago, and gives a much more comprehensive view about what needs to happen in order for you to feel well at work. And it's a lot more than just leafy greens, which I also support, and meditation. There's a lot more going on here, and that's, I think, what we want to be sure we get across, is that we as a team in the Office of Wellbeing are very interested in all of these things. So, why do we care about this? Well, we know, I think everybody in the room has probably experienced the fact that burnout, we're all at higher risk for burnout than the general population. This is data that was published in 2022, looking at, if you see in the green, this is physicians, so forgive me, bench researchers, but you guys are probably in this pool or pretty similar place too, but comparing physicians and the general population, burnout has been consistently higher and then shot up during the pandemic. There is some evidence that's been published just in the last 18 months that suggests this is leveling off. It's not continuing to rise, which is something we're very grateful for, but nevertheless, a real problem. And why do we care about this burnout syndrome? We care about this burnout syndrome because it impacts almost everything. You see on the left here, this is a graphic from one really important paper on this topic from 2017. On the left, there are all of these personal things that are happening. It impacts our relationships. It has impacts on, it increases your risk for a mood disorder. It increases the risk of suicide, and we're not immune to this. It also has real impacts in the clinical space and in our workspaces. It decreases our productivity, it impacts turnover, and it impacts patient safety. And I'll show you a couple of bits of data on that quickly. So from a quality and safety perspective, this was really some very interesting work that looked at tertiles of responses within the Maslach burnout inventory. So there are a couple of different scales in that. There is depersonalization, there's emotional exhaustion. Those are both shown here. folks who had the highest levels of burnout, which you see in those in the bars all the way on the right, were most likely and significantly more likely than others to self-report having made a mistake, having made an error. And we all know that we're much more likely to tell on others than we are to tell on ourselves. I'm being a little facetious here, but if we're owning it, and we're at the highest level, it's really important. It's impacting our work. It's also impacting us as a system, not just as Johns Hopkins Health System and Johns Hopkins Medicine, including the School of Medicine, but as a healthcare system writ large. So 4 points is a really, I think, really important paper published a couple of years ago. $4.6 billion is what burnout is costing us. And that's in those things that I just mentioned: turnover, productivity, errors, all of those things are in that estimate. And if we bring it to an individual level, almost $8,000 per clinician. So what's driving all of this? I'll just mention this briefly and walk through then what we're doing here. So this is a graphic from the National Academy of Medicine that we like to use to frame our work. And as I mentioned, well-being is a complex process. This is, for us, a roadmap to help us keep our eye on many of those different things. So there's the culture, there's the organizational commitment, leadership behaviors. Turns out it's very important what your division chief, your department director does and doesn't do in terms of your experience of fulfillment and well-being. Workplace efficiency, how easy or hard it is to get your job done. And for folks who have time or interest, at some point I tell you that stories about this workplace efficiency piece being one that was really important to me in getting into this work and well-being. Policies and practices and doing workplace assessment. Those are all things. I realize I'm coming in and out. Are you guys hearing me okay? Okay, sorry. Try not to shout when I'm faced in that direction. So what's happening here at Johns Hopkins in these spaces? So in the space of ease of work, again, we'll hit these very briefly. We've had a couple of pilots going on across the health system looking at offloading the administrative burden of prior authorization for medications onto the pharmacy technician who actually likes to do it. No one else likes to do it, but they like to do it, which I think is kind of cool and a win-win, with some great success in terms of people's experience of that space, of that prescribing space. AI tools. So we are in the process of broadly adopting an AI scribe as an institution. We're going to be studying the impacts of that, but that's a big piece of helping people get their work done in real time, so you're not spending time after hours. Connection and support. We've got some work going on. I'm going to highlight one specific thing related to this in just a moment. Mental health and peer support, big important pieces that we're thinking about and working on. Assessment. Dr. Oliva just mentioned the faculty satisfaction survey. We're actually part of what we do is do a burnout and well-being assessment every 2 years. So that also will be coming up in the spring, and you'll hear more about that. It's a great opportunity for us to understand how we're doing across specialties. So we do that for physicians, nurses, and our APPs, as well as some other clinical groups. This year, we're actually adding a survey for our basic science researchers, and really excited to be able to share that data as well. In the leadership behavior space, we're currently piloting some work at Howard County General Hospital. I don't know if anybody is working there, looking at how we strengthen well-being focused leadership behaviors. So I mentioned earlier that how your leader behaves and acts and what they do has a big impact on how you experience your work. And there turns out there's skills that we can teach and that we can learn that help us in this space. Policies and practices, very quickly. We have some work going on looking at stigmatizing questions around mental health, receiving and requesting or going or seeking and receiving mental health support. We know on a national level that those questions that are in your licensure or credentialing applications can deter people from getting the mental health support they need. And so we are working with our central credentials office to change that and bring it to best practice, to the best practice space. And that's some work we're working on in 2025. And finally, organizational commitment. This is an ongoing process. Just the fact that I'm here talking about well-being and new faculty orientation is a demonstration that the organization is committed to thinking about this, to having a dialogue about this, and continuing to work towards that end. But well-being is moving out into all these different spaces and conversations. I mentioned that I wanted to say a little bit more about one specific mental health support. This is a brand new service. It's called the Office of Clinician and Faculty Care. It rolled out in earnest at the beginning of September. It provides confidential, accessible mental health support. This is at no cost to our faculty, whether basic science or clinical faculty, nurses, and advanced practice providers. The reasons that this was stood up is that we recognize that those groups I just described were not necessarily as likely as others to use the EAP, the Employee Assistance Program. And so we've stood up this resource, which is staffed by Hopkins clinicians, for Hopkins clinicians and faculty, to make it easy to access. There's a link to get to this under Get Support on the website. So if you see that when you're looking on our website, and there are multiple easy ways to get to it by email. There's an online forum. There's a phone number. And we are really excited about this opportunity for folks. And then I will just wrap up. I'm not sure how I am on time, Rachel. How'd I do? With just saying it is just such a privilege to be here. We are here to serve you. Again, this is the same QR code. You can reach out to us. And please feel free to reach out to me directly or to reach out to us through our general website or our general email, which is owb@jhmi.edu. Thank you so much.